by the Secretary of Health and Human Services, he said to me, Ken, what will be your #1 priority? And that was before he offered it to me, I should say. He stood up and he said, what would be your #1 priority if I was to select you as director of this institute? And I had been an NIH scientist for years. I was in the National Cancer Institute, so I knew the way the National Institutes of Health operates. So I thought for a second or so I wanted to get this right. But I told him the truth, and I said, if you were to appoint me director of the National Institute for Environmental Health Sciences, my #1 priority would be to make the Institute responsive to the needs of the American people. And you cannot guess what the needs are unless you go out into the community and ask the American people. And that worked very well for us. We got our budget turned around. We more than doubled our budget twice. We were more successful than any institute in the 14 years that I was there in terms of the percentage of budget increase that we got every year from Congress in competition with the other institutes. And that's the bottom line, is the money. Because you need money to support the kind of program that we developed, community-based participatory research, and so forth. Now today, I'm going to talk about the science that I think is required and needed in the health disparities arena. And you can look up some programs in the National Institute for Environmental Health Sciences, or largely even in the NIH, because most of the community-based programs were created in the National Institute for Environmental Health Sciences, not in any other institute, from 1991 to 2014. And they're now doing those programs, and they're important. But it was my background that mattered to me. Now today I'm going to talk about a follow-up to Dr. Hannon's presentation, that environmental context matters. It's important for human health and diseases. You see in this first slide, this young lad, he's divided in half. One half of him grew, and this is the Los Angeles area, one half of this little kid grew up in one zip code, and the other half grew up in a different zip code. Now you can imagine that both halves have the same genetics, identical, no difference. You can see that the difference in life expectancy from birth is about 14 years. That's health disparity. What's responsible for that difference in life expectancy? New Orleans, Louisiana, even more disparate. Here are two zip codes. You can see Lakewood, and the other one is the Tulane area. Those are zip codes in New Orleans. The life expectancy in the Lakewood area is about 80 years. The life expectancy from birth around the Tulane area is 55 years. That's a variation of about 25 years. That's huge. Imagine dying at 50, all the things that you would miss. And I'm that age, so I know what I would have missed had I expired at 50 versus what I've done in those intervening 30 years. A lot. Accomplished a lot. So it's important to me. My grandchildren, I have 6 of them, and none of them were, I wouldn't have seen any of them. I got to see my sons who married late and get married. So these are the things that I got to do because I lived long enough to accomplish it. So if you go on the internet and ask what are the characteristics of the two neighborhoods in New Orleans, Lakewood and the Tulane area, you will discover that what you will see multiple times if you look up the Lakewood area is that this is the best neighborhood to live in New Orleans. Now, if you go into the Tulane area, they don't mention anything about that, but you dig deeper and you discover a lot of issues like poverty, poor education, poor housing. So it's the environment matters. A demographer at University of Washington, Seattle, named Chris Murray, and he's been doing these studies for a large number of years. He used to be at Harvard, and he did a county-by-county survey of the counties within the United States. And he's always 10 or 12 authors, and they concluded that the difference in life expectancy overall among these counties in the United States is 15.4 years for men. That means some counties, they die off at, let's say, 75 versus 60. So that's huge, again. And this is within the United States. Oh, I should have pointed out, let's see if I go back. The distance between these two zip codes in New Orleans is 3 miles. So what happens in the distance of 3 miles, it's not genetics, you can't explain that, just because I would say my daughter and the the governor of New York, Governor Patterson, lived in one of the most disadvantaged neighborhoods in New York City. But they didn't suffer all the consequences of living in that neighborhood. My daughter come by and raid my refrigerator because I was in New York downtown, and Governor Patterson spent a lot of his time in Albany, and he was well off. So neighborhood matters. Now, Chris Murray and his colleagues concluded that you could only account for the difference in life expectancy throughout the United States based on the environment. In other words, the environment matters, not genetics. Now, when I became director of the Environmental Health Institute, we weren't doing very well. And I'm not just saying that, you can read it, it's in the press. We were not getting a good budget. We had lost money, spending power, and constant dollar for 10 straight years. So one of the things we didn't have, we didn't know how to communicate. So I spent a day with expert in communication. As a matter of fact, he was the individual that prepared Bill Clinton for his first round of debates with George Bush. This guy was good. And the government allowed me to spend 1 day with him getting trained as how to communicate. He helped me to see that this was the message that we should put forward to explain to the members of Congress what our institute was about. And what it says is that human health and diseases are caused by 3 things: your genetics, your environment as a function of your age or stage of development, and behavior. Behavior is very important. Whether you exercise, whether you smoke, whether you eat healthy, that's your behavior. You control that. But age and stage of development is also important. Children, we know, are more susceptible to a lot of environmental pollutants like lead, and we understand why that's the case. Senior citizens like me are more susceptible to environmental exposure, and we understand why. Our immune systems are more compromised as you age. Children haven't developed the protective enzyme systems, and they're growing rapidly. You know, the brain's cells are multiplying. So we understand that. We understand the biology of why senior citizens and children are more susceptible. But just stop and think about this. There are only 3 things, not 100, 3. The environment, your genetics, and your behavior is really what is responsible for your health and disease. So you address those three and you've got it. Now, a quote that I used along with this triangle to communicate what we were about. And I remember being asked to testify before the Senate, and Senator Hillary Clinton and John Edwards chaired the hearing. And you have to send your testimony to the Congress in advance. And so my office sent my testimony, and Senator Clinton's staff had briefed her on my testimony. That's typical. So she is being interviewed before we testify at the front of the room. And they said, Senator Clinton, what's your views about the environment here? And she said, well, it's been said that genetics loads the gun, but the environment pulls the trigger. That was great for me. It was in my testimony that statement existed. So I want to say it to you. A loaded gun by itself causes no harm whatsoever. A loaded gun, though, has the potential to be deadly. But if you don't pull the trigger, nothing happens. You can also inherit a genetic predisposition to have a disease. For example, someone asked a question about BRCA1, breast cancer premenopausal susceptibility gene. Well, I'm very pleased to say that gene was isolated maybe 50 steps from my office when I was director of NIEHS by colleagues in my institute. And when I went away for the holiday weekend and came back, and I must have had 40 or 50 phone calls, and I said, my gosh, what has happened? And turns out that that was one of the great occasions that we had. It had been announced that these fellows had isolated this breast cancer susceptibility gene. That was huge. So I know a lot about it, and certainly we licensed it to the company that is now making the test to identify which people have the breast cancer susceptibility gene. Well, imagine